Is Arthur Dang. I'm one of the ID faculty members here at all of you. I'm sure I'll be meeting all of you guys in the next several months. I'm also the director of our antibiotic stewardship. And so I'm going to be talking about something that's very important for all of you, especially when you go on wards, and that is how to appropriately prescribe antibiotics and actually how to do that, because there are specific ways to do that, especially because many of our antibiotics are restricted. And as you probably know by now, going through medical school, antibiotic stewardship is a very important program in all hospitals. The members of our antibiotic stewardship team is myself, this is me, but we also have two pharmacists, two ID pharmacists that you're going to be interacting with quite a bit. They're exceedingly knowledgeable about antibiotics and when to use which antibiotic. And that's Brian, Kim, and Nikki shown here. If you see them in the hospital, say hi. So just a quick background for the need for our stewardship programs and the need for us to make sure that the antibiotics are used very judiciously. When most surveys look at retrospective look at antibiotic prescriptions in hospitals, at least half, and if you do really scrutinize it in more detail, probably at least 3/4 of the antibiotics that are prescribed in the hospital are inappropriate. They're incorrect. And you might think that the incorrect antibiotic practices are because they're not covering the right pathogen. That's what everyone fears anyways. But in actuality, the vast majority of them are that they're overly broad or they're not de-escalated. You already have the pathogen, you already have the answer, but they're still covering for bacteria that aren't there. And really, there's really no risk for those kind of bacteria being there. That's most common. That's the most common mispractice. You all know that the antibiotic resistance is not only a huge concern in the United States, it's certainly a huge concern in the United States, but it's also a global concern. So it's caused the World Health Organization as well as the CDC to come out with many statements how we need to really change the course of action that we're doing. And there's a law that every hospital, every acute care hospital needs to do antibiotic stewardship and show progress in terms of our strategies, our interventions, and our efforts that has some sort of a consequence as far as a positive outcome is concerned in regards to using antibiotics judiciously. In the County of LA, the Department of Health Services, there's also what's called these prime metrics or prime Medi-Cal waivers, where for all aspects of surgery and medicine, there's all these measures that we have to actually meet. Otherwise, we'll lose millions of dollars of our funding. So it's actually critically important to, especially our administration, that we meet these milestones. And there's these prime metrics for antibiotic stewardship in our hospital. And one of them that's important for you to know is that every dose of an anti-MRSA, anti-Pseudomonas, or a carbapenem type antibiotic that we prescribe is being measured. And then and then we have to be under a certain threshold of each of these agents. Otherwise, we will fail this metric. So that's why, again, even beyond the need to judiciously use antibiotics, the prime metric is another incentive that we have to make sure that anytime we prescribe drugs like vancomycin, for example, or Zosyn or meropenem, that it is really done when it's truly needed. And JCO, which also we just went through a JCO survey, but they also look at our stewardship measures and our outcomes as well. So all these things are why antibiotic stewardship is very critically important. And so the goal of our stewardship program is to optimize the patient's clinical outcomes while trying to minimize, ideally eliminate the unintended consequences of antibiotic usage. And in particular, that is the emergence of resistance in bacteria. And that happens when we overly use antibiotics or use it for too long or use overly broad antibiotics. Drug toxicity, antibiotic toxicity, which particularly is going to be the case with vancomycin, because it seems as if a lot of people don't recognize the toxicities of vancomycin. They kind of give it a lot of times just in case or when it's not needed, especially when people already have pre-existing kidney disease, and it is a relatively nephrotoxic drug. And of course, the needless use of the overly broad antibiotics, which also tend to be the more expensive ones as well. We all want to try and do our part in trying to contain the really extraordinary high healthcare costs in the United States. And so we help promote the right way to use antibiotics. And so, in all the county hospitals and really in all good academic hospitals, antibiotics are restricted. So at the DHS level, so all of the county hospitals, that will be LAC USC, Harvey CLA us. These antibiotics that you see here are all restricted. However, all of you, we do have something that's very unique, and that is what's called a pre-approved restricted antibiotics for very commonly requested ones. And that's on the left-hand side of this table that you see here. And all the other LA County sites, by the way, these are all fully restricted. So you have to call the antibiotic approval pager to get them. So these 4 drugs, which are cefepime, piptazor, and vancomycin, have these pre-approved restricted indications. And then voriconazole has one mainly for the oncologists for antifungal prophylaxis. So that's not really going to be that relevant for you all in the intern class right now. But for these other 3, though, vanco, piptazor, and cefepime, we try to come up with really, like 95+% of the reasons why the appropriate reasons why someone would use it. And if you're able to indicate that in the order that you're using for one of these pre-approved indications, the pharmacy will fill it without needing antibiotic approval from the ID pharmacist or the ID fellow. And so I'm going to go through it. So it's very important that you do it correctly. Otherwise, you'll get called by the pharmacist and reject your order. I'm going to go through how to fill out the order. So please put on your concentration hats right now. So when you write an order in ORCID, for an antibiotic, there's going to be an indication field. And so you're going to, in the indication field, and I'll show you a screenshot of this, there's a pull down menu and you're going to click onto the pre-approved indication. Now make sure, of course, that the patient does have one of those indications and you don't just click something that is pre-approved. For example, do not click nosocomial or hospital-acquired pneumonia when the patient has community-acquired pneumonia. All of these get reviewed either later that day or the following day. So if you're doing it incorrectly, it will be known by the pharmacy and they'll actually notify the ID service. For the antibiotics that do not have a pre-approved indication, so not cefepime, vanco, or zosyn, you actually have to put the approving provider, type in the approving provider under the field, and that's going to be most commonly the ID pharmacist that approves it, because when you call the pager, it's going to be answered by the ID pharmacist during working hours, or in the off hours, meaning at nighttime, holiday or weekend, the ID fellow you can put the ID fellow's name if they answer. But as you'll see here, at the nighttime, for the most part, you won't need to do that because the pharmacy will fill 1 dose of a restricted antibiotic in the nighttime hours. The antibiotic approval pager is located on the Amazon page, which is where you page everything else in medicine for consults. And there'll be one that just says antibiotic approval pager that I show here in the screenshot on the bottom. Antibiotic approvals, that's what it is. And so it gets forwarded in the off hours to the ID fellow. And then in the working hours, the ID pharmacist will answer it to approve it. If they don't approve it, just so you know, since both the ID fellow and the ID pharmacist are experts in this area, it's highly unlikely that what you're using that drug for is going to be the appropriate way to use that drug. But if you do feel that it warrants further discussion, then feel free to page me. So here's a screenshot of the example of how to do it. So here's a drug cefepime, right? And so one of the pre-approved indications is if you have neutropenic fevers. And so if you pull on the pull down menu and click onto febrile neutropenia, then you can get cefepime for that neutropenic patient. However, if the antibiotic, let's say it's not cefepime, but let's just say it's meropenem or daptomycin, another drug that's a fully restricted drug, then put the indication down, but you still need to type in the approving provider, which again will be in the working hours Brian Kim or Nikki Arab or the ID fellow. If for whatever reason the ID team is the one that approves that antibiotic. And so if you don't do that, the pharmacy will reject it. If you don't do what I just said, the pharmacy will reject it and it must be re-entered. And so it's important because sometimes you want to get the antibiotic as soon as possible in the patient, and they may be really sick. So it's just really important to do this the right way the first time so you don't go through this process of redoing it. And so overnight, though, as I mentioned earlier, overnight between hours of 7 p.m. and 7 a.m., the pharmacy will dispense one dose of a restricted antibiotic without having the ID approval. So because remember the the pharmacist goes home at normal working hours, right? So in the off hours, 7 p.m. to 7 a.m., if you do write an order for an antibiotic that's restricted, it will get filled. They'll get 1 dose. If the patient already has a pre-approved indication, say for cefepime or Zosyn or Vanco, then go ahead and do it the right way. That way, in the morning, you will not be contacted by pharmacy to do it correctly. So everything will be done overnight, even. However, if it's a fully restricted drug, like say meropenem or daptomycin or linezolid or one of these fully restricted drugs, then in the morning you're going to have to call the antibiotic approval pager and then do it the right way. Again, the antibiotic approval pager is on amion.com. So we at All of You try our hardest to help you choose the right antibiotic for your patients. And of course, infections are one of the most frequent reasons for admissions on your ward services. So this is just one, every time you're on call, you're going to get several infections. And so we went through a lot of lengths to create these empiric antibiotic recommendation cards that you see here. That it's actually this color this year, pink this color this year. And all the chiefs are going to hand this out to you if they haven't already. And so you can see on this card that on the first column is going to list the most of the 90% of the infections that you'll see in the inpatient service. And then we list the pathogens that cause that infection because, we understand that, especially at the intern level, you may not necessarily know in every infection what bacteria are causing what. And what happens when you don't know what bacteria causes what is the common human practice is to try and cover for everything under the sun, from MRSA through Pseudomonas. So it's important that we recognize which bacteria cause what infections. So we list that for you there. And then we have in the third column here, we have our treatment recommendations. And the treatment recommendations are all based on national evidence-based guidelines, as well as our local antibiograms, our local resistance rates here. And the fourth column is just some special considerations, including when to use steroids and things like that. Please don't use UpToDate for these empiric antibiotics because UpToDate, first of all, in ID has a lot of errors. Whenever I look at it, I catch errors. And if and when they recommend antibiotics is not specific for our area of the country. So it may not be relevant or applicable to, say, here, All of You, or Los Angeles County. So this card, again, is going to be given to you, if not already, by the chiefs. Now, this is a fold-away card, so it's quite easy to keep in your pockets, especially if you wear a white coat. Very easy. However, I see when I look around the wards that a lot of residents don't wear white coats. So therefore, there's another way I'm going to show you in a sec here about how you can get this onto your cell phone. On the back side of that card, in case you don't remember what we just went through as far as the pre-approved antibiotics and which antibiotics are fully restricted and the hours when you have to call the antibiotic approval pager and when the pharmacy will dispense 1 dose, we actually printed that out for you on the back side of the card. And this is I'm blowing it up here in terms of what it looks like. So on the left-hand side, you can see here, this is the hours when you can get it by calling the antibiotic approval pager, and then the off hours, you can get 1 dose, but then the following day, you're gonna have to call the pager. Or if it's a pre-approved antibiotic in the off hours, and you do it the right way, you won't be called in the morning. So that's, again, obviously the better way to go. So I don't know right now, I didn't receive a reply from the chiefs yet, but we're going to, if not already, upload this card onto the allofyouim.org website. The allofyou.org website is your website, the residence website, and you'll be using this website for various things. But we're going to upload this card onto the website so that you could download it onto your phone, because even if you don't have a white coat, what I noticed is that everybody has their cell phone. So you're not going to be without your cell phone. So that we want you to never be without this resource, basically. So and so when you pull up the allofyouim.org website on your phone, this is what it looks like. And so what you're going to go to is tools. So you punch in tools, this page pops up, and you see that on this page, there's something called antimicrobial stewardship. So you click on your phone, antimicrobial stewardship, and then it's going to ask for a password. And the password is the same password that you're going to use for Amion to page people. This is going to be a password that is seared into your brain, which is OV space IM. And then when you click on that, it brings you to the download page for the card. So you click onto download the card, which is going to appear on your phone as a PDF. After that, you get the PDF, you're going to have to save it onto your phone. You can do it in whatever way you want to, but you click that, see export. This is on an iPhone. I don't have a Android, so I don't know how it looks like on an Android, but you click onto the export and you get this page on an iPhone. And then, you know, for example, you could add it to your home screen as like it looks like an app, and you just click onto that icon, and then it brings you the card. So I will highly encourage you to do this as soon as the Chiefs gives you the green light that they've uploaded the most recent, the pink card. Last night when I checked, it was still last year's card, but we asked the Chiefs a couple times now to upload the most recent one, the 2021 to 2022 one. So once they give you a green light, please do this so that you can have the card on your phone. So even if you don't have your pink card, you'll have this resource. The other thing that the antibiotic stewardship does every single day is leave these stewardship notes. And it looks like this that you see in the blue line there, antibiotic stewardship note, where we are reviewing your patient and the antibiotics that they're on and seeing if it's appropriate or not. A lot of effort goes into this. It's not just a quick decision. You know, everything is reviewed. Essentially, a consult is done. The only thing that's not done is seeing the patient. But otherwise, every lab, all their history, radiographs, all reviewed. And then we come up with whether a recommendation for whether they need an antibiotic or whether they should be on a different one. So, you know, this is an example of the text of that, where this says to discontinue subtraction in this case, because although this patient was felt to have a UTI, this patient does not have a UTI, and we try to explain what the definition of UTI is in this case. And you'll usually see an addendum by me on the bottom. If you scroll down enough, you'll see an addendum by me on the bottom to add perhaps more detail from the ID attending. When we leave these notes, please respond to them. Either heed them, or if you think that the stewardship team is missing something that's not apparent in the history, or then call us back and tell us, oh, did you know that this or that, you know, was the case? And therefore, do you still think that the patient either doesn't need antibiotics or needs a different one? Please communicate with the ID pharmacist on this. Please don't just, if you disagree with it, or if your attending disagrees with it, just ignore it. Because, you know, we kind of keep track of who is actually listening, who isn't. And for the teams that aren't listening, then we start worrying about that particular teams, especially the care that they're giving for their patient with that infection. And then we might even call have the ID team follow that patient because we're so worried about the decision-making process. So please call back, even if, and especially I should say, if you don't agree with what's going on, and especially if you think that we're missing something. On the allofuim.org page, there's an antibiotic stewardship link that I want to show you, and that is this icon here. It looks like the coronavirus that you can see, and that's just the link to antibiotic stewardship page. If you click on it, it brings up the stewardship page that you see here, and you can obtain the card, and the new card is uploaded to this page here on a desktop computer. And this page, by the way, is also accessible from your cell phone too. So you click onto this card here, and it brings up the card. You can save it that way too. So the new card is on this method of getting it. On this page are also some other resources. So at all of you, we're using this BioFire multiplex PCR system to very, very quickly identify the bacteria or fungus in your blood once you send a blood culture. This is something new, probably even new to your attending, so they may not really know what to do when the BioFire blood culture system tells you immediately, even on day of admission in the hospital, what the pathogen in the blood is. So if you're not sure what's going on, if you say, oh, the BioFire is saying I have this in the blood, what should I do? You click on it, it'll tell you which bacteria the BioFire identifies. It doesn't identify every single bacteria under the sun, but here are the primers that it has. And the resistance genes, for example, MEK is for MRSA, VAN is for VRE, KPC is for CRE. And if you scroll down on it, you have our antibiotic recommendations if you identify that particular pathogen in the blood. You can also feel free to call IDs if you want as well. However, this is an initial recommendation on what to do if you see that bacteria in the blood. Again, this is something more advanced in this rapid diagnostics. We're in the era of that now. It's something your attendings may not be quite as familiar with. Other resources, if you're not sure how long to give antibiotics for certain commonly seen infections, we have that here via evidence-based medicine. A lot of us came together in the DHS system and reviewed the evidence-based medicine and came up with this expected practice that you see here. So you don't, again, have to call ID to say, hey, I have, this infection, what's the duration? The antibiogram, you're not going to know offhand, obviously, what the resistance rates, what is the E. coli resistance rate to say Cipro? You don't know that offhand. So every year we compile this antibiogram, and if you look at it down here, you can see that the resistance rate in E. coli in the outpatient setting to Cipro is almost 40%, which is quite shocking, I'm sure, to all of you. Almost half the E. coli in the outpatient setting is resistant to Cipro. And so this antibiogram, by the way, this is a new for this year, included it on your pink card as well. So you don't necessarily have to go to this website to look at it. So your pink card has it now. That's something new. So that's it. Congratulations, new interns. There's going to be kind of a steep learning curve for all of you guys, but we're all here to help for any antibiotic or infection-related questions. And if you're really not sure, please ask, and good luck. And I believe Dr. Matheson, the Chief of ID, is on next.